I presented today my data on gamma delta T-cells in combination with Ibrutinib treatment as a possible strategy to use in CLL therapy. And the idea that we started with was that we can make use of the own immune system of CLL patients, since we've learned from especially transplantation data that we can use T-cells from the patients to eradicate all of the tumor. And in fact, transplantation is still the only curative way to treat CLL. So we went and looked for a new strategy to use T-cells in CLL without using conventional alpha-beta T-cells, because in CLL these alpha-beta T-cells have functional impairments that we know of. So we wanted to investigate these gamma delta T-cells that have a natural tendency to recognize and kill malignant cells and see what their role was in CLL. Actually, what we found was that indeed these gamma delta T-cells also recognize and kill CLL cells, so that makes them suitable candidates for exploiting in CLL immunotherapy. But what we also found that is that, like the alpha-beta T-cells, the gamma delta T-cells from CLL patients function less than gamma delta T-cells from healthy people. So then we actually went on to look for ways to improve on that function, because if we want to use the gamma delta T-cells from CLL patients themselves, of course we have to improve their function as much as possible. But we saw that in our culturing experiments, we could actually get the function of the gamma delta T-cells up to the level of healthy control T-cells using an expansion method with phosphoantigen expressing dendritic cells, which was also an effective way to expand these gamma delta T-cells to numbers that are equivalent to those needed for CAR T-cell therapy, for instance. So it's feasible to expand these gamma delta T-cells and also improve their function. And then we also looked at the combination of gamma delta T-cells with Ibrutinib, since Ibrutinib is more and more used in CLL treatment, and it also has the interesting effect of inhibiting ITK, actually is an off-target effect. And through inhibition of ITK, it can also influence T-cells. And we found that treatment of Ibrutinib of the gamma delta T-cells actually made sure they had a more anti-tumour cytokine secretion profile. So the Ibrutinib treatment seems to be a suitable candidate to actually improve the gamma delta T-cell function as well.